we're really on the out there on the cutting edge envelope, because that's where things are happening. That's where healing takes place. People are tired of the same old humdrum, take a pill, get something cut out, take a pain pill if you're in pain, and that's really not where healing is. You've got to get to the root cause. And in our practice, we utilize all the cutting edge technologies. We use the PEMF, we utilize light therapy, SpectraBright, we use the Spectra Light for blood irradiation, we use ozone. All of these things really get to the root cause of where people's illness is, and it's a detoxification process, a purification process, because we live in an environment that is so toxic that we have to get people's attention to say, looky here, you've been taught all these years, because I don't have one patient that comes in, I say, how do you eat? Oh, I eat pretty healthy. What's your definition of healthy? Oh, I have cheeseburger and fries and onion rings 3 times a day and a quart of ice cream. Well, that's what we ate when I was growing up, and I know my mom would fix healthy stuff. Well, yeah. So it's a program. What do people think? What do they know? What's healthy? So whatever they've been taught is healthy it may be or may not be. So we have to change that paradigm, and that paradigm is shifting big time, because people are so sick they can't get well. One in every 2 people can come down with cancer now. That's phenomenal. And autism, in males, 1 in 68. Females, I think it's 1 in 115. It's ridiculous. It really is ridiculous. And it's a curse on mankind to have our health degraded like this, because you can't live your God-given potential if you're sick. If you don't have your health, you don't have anything. We use the PEMF with every patient. Almost every patient. Sometimes it's contraindicated. Pacemaker or metal implants in the ears or something like that, we don't. But I still use it on a foot. If they've got a heart pacemaker, I'll still use it on their foot. And we use that in conjunction with the light therapy. I've found that those two together really are so dynamic, because there's something about that combination. Light is amazing, and you add the PEMF on top of it, it works really good. Cerebral palsy. We had a young man, he's been my patient for years, and we were having phenomenal success with the treatments that we do. And when I first bought the PEMF machine, I took it back, and I was watching the video, and I go, well, I got a guy that I think I can help with that. And sure enough, he started coming in, and his family doesn't have a lot of money. So I said, you know what? I want him to get the full use of this, so I'm gonna charge you $15 a week. You come in as many times as you want. You don't have to make an appointment, just stop in, the girls will take care of it. And it got to the point where this kid, he'd love coming in, and he'd run the machine himself. He'd put it on his head, he'd put it here, and I've got a video of the very first time he came in, and then 6 weeks later when he came in, completely different kid. And that was 2 years ago, and he's grown 12 inches in height, and it's just amazing. This kid just blossomed, and he can talk now. Before he hardly ever talked, but now he comes in and he teases with my staff. And so, it's those types of things that really make what we do enjoyable, because we can introduce something that changes a person's life. And the same way with the Spectra Light that we use. You've got to get to the root cause of illness, and by treating the blood with those different methods, ozone, Spectra Light, full spectrum light, either topically or on the blood, those types of things are vital for changing a person's life and changing their digestive system. That's where life begins. I have found with the intra-articular injections of ozone, PRP, platelet-rich plasma, and we even developed a protocol where we take the blood out, and before we spin it down, we ozonate it, and then spin it out and separate it. And we do those injections, and every injection site now, I always follow with PEMF because it helps to get that worked into the joint, and we just have much better results. We have phenomenal results with the injections, with ozone and with the BioOcean, the homeopathics that we've developed. But when you add that cellular exercise on top of that, it's just amazing the results that we get. People healing at our office where they haven't gotten healing at other offices. We have a lady from down in Oklahoma City. She called one day and she says, you know what? I need to come see Dr. Dan again, and was talking to my staff, and my staff says, well, there's a lady that called and wanted to know if she would go see this other doctor down in Oklahoma City or come see you. And the lady says, I go see Dr. Dan because his injections work. The biggest difference I see, the PEMF. I think this other guy has a PEMF too, but I don't know what the deal is. The way we do the injections and the rate that we put the PEMF on, you know, just at perception. After an injection, just when they can just barely feel it, seems to do the best job. But that's, we use it with every injection. PEMF goes along with everything in our office. It's not contraindicated in most things, and when we can use it, we do.